body thrives. We need to let the circadian rhythm be in sync with nature, get up around sunrise, stop our activities after sunset. Uh, you know, and the body has its ways of giving us feedback also that things are not right. We need to be aware enough to listen to those signals. If we are feeling palpitations,
Self-awareness, right?
self-awareness. If we are feeling palpitations,
Mm.
then that means the heart rate is high. We are probably anxious. Some emotional outburst is happening. If we just become aware of this and take a deep breath, we will notice the change. We'll notice the heart rate slowing down, the respiratory rate slowing down, the breathing becoming slower and deeper. And that just, it's so simple to do. And I think because breath is simple, it is often overlooked as something which is not impactful. But that's the
Yeah.
beauty of it, you know. So yeah, body has a lot of self-awareness and self-regulation.
So, doctor, actually, I was also thinking about our medicine and the education that we get in our medical school. I think in medical school, we look at the body just as body, you know, you know,
Yeah,
but there are other layers of it. Like, in
yeah.
ancient wisdom, we divide the body into 5 layers, you know.
5 layers,
Uh,
exactly.
the
Yes.
first layer is Anamaya Kosha, which is
Annamaya
your food
Kosha.
body. So in
Yes.
medical school, we get
That's
all
all.
the knowledge of Anamaya Kosha, the food
Yes.
body, our main
Yes.
body. Then
Yes.
the second layer is the Pranamaya Kosha, which is
Pranamaya Kosha.
breath, your breath.
Yes.
I think
Yes.
in medical school, we don't get much education on the Pranamaya
Yes.
Kosha, which is the breathing system, like how our breathing affects our autonomic nervous system. And the just by changing the breath, you can change the signaling to your body, like vagus
Yes.
nervous activation, parasympathetic system, and a lot of other things. So that layer is not much taught. Then the third layer in our ancient wisdom is our Manomaya Kosha.
Manomaya Kosha.
That layer is also only taught to psychiatrists or psychologists, right?
Yes.
Normal
You have
medical
learned.
school,
You have studied that.
yeah,
Yes.
but normal medical school, a
Mm,
doctor is not taught
hardly.
about
Yeah.
Manomaya. And then there
Correct.
is more koshas in with
Gyanmaya Kosha.
and
And
then
then Anandamaya Kosha.
so the education in medical school we get is focused on the Anamaya Kosha.
And
I think that is where it has a limitation. Traditional medicine,
absolutely.
they don't go beyond
Agreed.
that. And what you are doing right
Correct.
now is that you are integrating all those layers. You have learned about the Pranamaya Kosha, so you know about the breath work and what does it do. You have worked on the Manomaya Kosha, so you are becoming a complete holistic doctor by providing these services to your patient, in which you not only take care of their body but also their breath and their mind.
Well, I'm just trying to apply some learnings that I have picked in my own journey, and I feel responsible of giving it back. I feel that as a doctor, if I had to struggle so much to understand that there are these solutions, it is think about patients who are not doctors, right? It's so difficult for them. So I feel responsible to educate the world, make them more aware about all these different aspects of health.
Yes, yes. So, doctor, let's go a little bit more into specifics. Like for a patient with diabetes or high blood pressure, heart disease, anxiety, or chronic stress, how can breath, movement, sleep, food, and routine support the medical treatment, like you mentioned earlier?
Yes. So this reminds me that, you know, when we were medical students, and I am a very big fan of the book, textbook Harrison, textbook of internal medicine. I remember that in all of these conditions that you have mentioned, right? Diabetes, hypertension, there was always a section on lifestyle intervention and stress, which was
Oh.
it was the smallest segment, right? Hardly anybody would actually even talk about it during the actual clinical posting. But yes, great that you bring this point up because these are really, really important. Just to make it easy to understand, I'll give an analogy. It's like if we are standing on the floor, right? If we are standing somewhere, and we have diabetes or hypertension, the medicines that we are taking, they make sure that we stay on the same floor. We don't fall further to the floor below. But the lifestyle interventions do the job of taking you, it's like a staircase, taking you to a slowly to a higher floor. I'll explain how. Right? The medicines are very, very important. They are needed to keep your HbA1c or your blood pressure or blood sugars in control. But equally important is to also work on the underlying mechanisms in the body which are leading to these deranged biomarkers in the first place, right? And those underlying causes are inflammation or sympathetic overactiveness or over response or chronic stress, right? These are the causes, root causes. Unless these are treated, it is going to be very difficult in, especially we see in some patients, despite maximum medication, their diabetes is just not coming under control. We label it as poorly controlled diabetes or uncontrolled hypertension. These are legit diagnoses. Why does that happen? Because we are not really looking beyond, we are not looking at the root causes of all of these, which are rather in some way manifestations. So when we get into breath work, when we get into a sleep regulation or a very strict routine, or for example, in hormonal conditions like PCOS, we avoid processed food. In autoimmune condition, also we should avoid, processed food, gluten, lactose. A lot of things are now coming up with modern research. All of these are part of lifestyle. And speaking specifically about breath work, because nutrition is not really my area, but breathwork is definitely important to again bring you back in that bioregulated mode or bring you back into the rest and digest mode so that your body can fight with the disease better. For example, there are various pranayams which directly help in immunomodulation, right? They help in improving immunity. They directly affect a lot of inflammatory markers. So they reduce inflammation. All the cytokines, the TNF alpha, interleukins, they are shown to be reduced with chronic or regular pranayam practice. Uh, so all of this becomes very important. Even in long-term meditators, there has been evidence to show gene regulation or epigenetics, getting affected. Even the telomere length gets affected. So longevity is also, this is all, peer-reviewed
Doctor, can
research.
you explain what is epigenetics to our audience
Yes,
listening
yes, sure.
a little bit?
So more and more research, yes. So more and more research is now showing us that uh, there are two parts to, there are two parts which decide how our life or how our health actually progresses. One is the genes that we are born with, that we inherit from our parents and from our forefathers, actually. And the other is the epigenetics, which is the effect of the environment that we live in. And what exactly is this environment? This environment is the things that we are talking about. The environment that we are giving to the body is the food that we are giving to the body. It is the stress, whether it's high or it's low, how that is being managed. How is the overall breathing in the body, or what is the general atmosphere in which. So everything else apart from genes, everything, whether you are exercising, whether you are mobile or whether you are sedentary, whether you are smoking, everything is epigenetics. So lifestyle is actually epigenetics. And more research is proving that previously we used to believe that genes that we inherit play the dominant part in how we, live our lives or how many diseases we get and how they progress. But latest research shows more and more involvement of the epigenetics. In fact, some studies have said that epigenetics is entirely responsible for everything that goes on in our body, not our genes. So all the lifestyle factors, all the breathing, all the nutrition, the circadian rhythm, the sleep, all of this is epigenetics. And unless we control that, we will find it very hard to control, these metabolic diseases.
So, they say that you are the maker of your destiny. So you may be born with whatever genes from your ancestral pool of genes you have. When you're born with this body, decided by the DNA. But when you grow up, you have the power that you can change your destiny and decide your destiny. So whatever epigenetics, what environment you are giving to your body, what food you are eating, how you exercise, so you can, even if you're predisposed to certain disease. I think I was predisposed to diabetes. That's why I got to diabetes so early. So that was in my destiny. But then if I work on it, try to nurture it, give my body, you know, good nutrition and exercise, sleeping, and all those things, and my mental health, I can manage it better.
Absolutely.
So I would like to know from your journey, it seemed like you had a moment when you felt like, wow, I got it. Did you, did you, like almost like enlightenment, kind of, and I can see that on your face actually, you know, I
Probably
have,
what you
because
can
see,
see on my face is the setting sun in India.
no, I'm telling you, because see, I'm a psychiatrist. I see lot of patients all day, and I have been doing it for last 15 years. I can see that your face has that calmness and that glow that is coming from somebody who has learned something, you know. So what is that
Thank
moment
you.
that you felt that way? That, oh, I
Thanks.
got I
Mm.
got it.
Thanks for the compliment.
Hmm.
Enlightenment, I think, is a very, very big word, and I believe we are too far from it. I am definitely.
Yeah,
But
yeah.
yes, there were moments when I felt elated, when I felt like, wow.
Yes,
And to be
yes.
honest, there have been multiple such moments. But the crux of all those moments is whatever I am learning new, whether it is about the breathing, about the pranayam, or about, like Swara Yoga is a type of yoga or pranayam which tells about the connection of the alternate nostrils with the hemispheres, the right and left hemispheres connecting with the right and left nostril. This is one example. But whenever I read about any of these things which come from our ancient wisdom, which I mentioned in our scriptures and have been passed down from generations over centuries, when I read research papers, which basically are testing these practices on the frameworks of modern science,